Today I am going to speak about workplace violence, its impact on nurses and patient safety. I will be discussing about the backgrounds, objectives, outline of the topic and the conclusion. The National Institute for Occupational Safety and Health defines workplace violence as the act or threat of violence towards the person at work, including a wide array of actions from verbal abuse to physical assaults. The risk of violence all over the world to the health workers throughout their career is between 8% and 38%. Many studies about workplace violence explains that the staff experience physical and mental breakdown as well as lose their motivation towards their job. According to one of the cross-sectional study conducted, states that 87% of emergency nurses reported violence that were unavoidable, triaging identified as highest risk nursing activity. On the contrary, the study also concludes that the nurses accept the patient violence in the emergency department as the normal behavior of the patient and didn't report unless physically injured. Studies also shows that mental health nurses abused frequently were affected more by staff resilience, post-traumatic growth and job stress in comparison to workplace violence. About 70% of respondents reported experiencing occupational violence and aggression within a 12-month, while 23% responded experiencing regular episodes of violence or assaults, mostly from the patients or relatives. Furthermore, higher level of reported violence and bullying were associated with more near misses events. One of the studies showed that patient-related violence was reported by 87% of nurses within the 6 months and was categorized as nurse-related patient violence. Emergency department specific factors contributing to violence. Patients with alcohol intoxication, mental health issues, and shared substances misuse were the groups with greatest risk for potential violence. Workplace violence is a contemporary issue because it affects the physical and psychological health of the healthcare staff, job motivation, and productivity. Furthermore, it contributes towards prolonged work stress, sick leave, burnout, increased state of depression, decreased job satisfaction, and increased turnover in tensions. Besides work functioning, relationship with the patient, social, general, and financial aspects are compromised, and repercussions in the workplace with the consequences of workplace violence exposure. Studies shows that almost half of the respondents Studies shows that almost half of the respondents experienced occupational violence or aggression at least a few times in the past 12 months. They stated that the patient visitors were responsible for the violence and aggression, and the incident was higher in aged care facilities in comparison to public hospitals. The report also states that the respondents 21% of the aged care facilities and 18% of public hospitals took days off work due to occupational health and safety incident within the last 12 months. Violence and aggressions are the elements that do not belong to any nursing or midwifery job. However, they are always on the receiving end in their workplace. An approach of increasing hospital security, improving staff to patient ratios, public campaign against violence and aggression could be one of the many elements in mitigating issues of workplace violence. Risk management is a systematic process which includes identifying hazards and assessing risks, controlling the risk, improving the work system, and providing training as a preventative measure. Among the healthcare staff, nurses are the most exposed members towards workplace violence. Hence, program for training and incident reporting should be provided by the hospital, notably towards the nurses who are at higher risk areas such as dementia patients, Alzheimer's diseases, patients with drug-seeking behavior, and drug or alcohol influenced patients. As a new graduate nurses, we are more vulnerable to becoming victims of violence, which has been supported by many studies. The violence towards newly licensed nurses is also known as vertical violence, in addition to the horizontal violence, because it is frequently perpetrated by someone higher in the hierarchy, and as a result affect patient safety as well as the safety of healthcare providers. Hence, the effective management of workplace violence by new graduate nurses can be achieved by developing a sound knowledge and skills for ensuring safety for everyone engaged in the healthcare environment. A sound knowledge and understanding of workplace bullying, aggression, and violence, updating about legislative guidelines, strategies to de-escalate, and some practical techniques are essential for adequate preparation of new graduate nursing. According to the Nursing and Midwifery Board of Australia, as a registered nurse, we need to think critically and analyze our nursing practice for providing safe, appropriate, and responsive quality nursing. The International Code of Ethics 2012 explains the fundamental responsibilities of the nurses, promotes health, prevent illness, and restore health and alleviate suffering, hence giving us the framework for the standards of conduct. Furthermore, the Code of Ethics for Nurses in Australia 2008 helps us to identify the fundamental ethical standards and values, our commitments that are incorporated in nursing guidelines and standards of conduct. As a new graduate, we are responsible for responding to work-related violence and follow the policy for work-related violence, which indicates the actions to take at the time of incident, immediately after, incident management, investigation, and principles. The work-related violence risk assessment tool is also essential for assessment and management of the violence risk factors. One of the fundamental parts of effective nursing is leadership, and the nurse is the leader in patient care. Studies have shown that contemporary nurses are strong enough to influence health policy. Nurse leaders are the ones who are being involved in the patient care. They are knowledgeable and skilled and being supported with available resources. Hence, they have the opportunity to take part in developing health policies. Nurses help to coordinate care and provide support, control infection, manage medication, and assistance with activities of daily living and many other parts of these incomprehensible care. Hence, effective nurse leadership can improve patient health outcomes, organization structures, and leadership recruitment and retaining of the skilled and engaged workforce, and maintain productivity and cost effectiveness of health services. An effective leader can help in preventing work-related violence by implementing policy, assessing risk prevention procedures, and training, reporting and investigating incidents with follow-up and reviewing the whole process to keep the system safe. In conclusion, workplace violence is a contemporary issue important to create a safe working environment. It is safe for the staff members as well as our patients, hence increase patient outcomes. Thank you very much.